Welcome to this episode of Monday Morning Joe. I'm Dr. Chuck Vega from the University of California at Irvine. Monday Morning Joe is a quick-hitting coffee talk style 4-episode series where we talk about the latest and greatest regarding multi-cancer early detection tests, or MCEDs. The goal of this segment is to provide clinicians with information relating to following up either a cancer signal detected or cancer signal not detected report from an MCED test. In the last episode, we talked in more detail about how to incorporate MCED screening into your clinical practice, so check that out. Before we begin, I want to remind everybody to please subscribe to the Exchange CME YouTube channel and turn on your notifications so you don't miss new episodes in this series. And with that, we're ready to begin. So we talked last time about how to incorporate using an MCED in your clinical practice. It starts with good patient communication and a thorough assessment for cancer risk factors. Getting them on board with the fact that this is a screening tool, not a diagnostic tool, and if there is a cancer signal detected, you will have to initiate a workup for cancer, and that's exactly how we're going to spend a lot of time talking in this episode in terms of our focus. And then the notification results usually you can expect it within 10 to 14 days, and it comes through a portal that's secure. So you have two potential results from the currently commercially available test from Gallery. It's no cancer signal detected or cancer signal detected. And again, one advantage of this test is that it will suggest either one or possibly two sites of origin for the cancer based on the methylation pattern that is observed. So those are the two options. Let's talk about what to do when you have, starting with cancer signal detected. So really, this is a signal that you want to take seriously. Patients are going to be very concerned, rightfully so. But I always tell patients, okay, it's something that I want you to take seriously, but I don't want it to dominate your life. We are going to initiate a workup. We are going to try to be as prompt as we possibly can in that workup. But yeah, there is still a chance that it may not be a true positive cancer signal. It's also very important to think broadly about the types of workup that you want to pursue, which is all about that cancer site of origin. So I am going to target not a general screen for cancer, with a PET scan or something like that. That can be indicated, but usually I'm going to do something more specific. And so let's look at some examples now that might, I think, provide a little bit of extra clarity on this. So say the site of origin is colorectal cancer. Well, I'm going to order a colonoscopy for that. What if it is a pancreatic cancer, gallbladder cancer, liver cancer? It's going to be CT with contrast of the abdomen, perhaps even a GI consult. Think about tumor markers, alpha-fetoprotein, for example, if there was a suggestion of liver cancer. Let's go through a couple more as well. Lung cancer, that would be a chest CT with and without IV contrast. Ovarian cancer could start with just a simple a pelvic examination, and then along with an ultrasound. And then if that was negative, I would order probably an MRI to get further workup. A CA 125 level would also be indicated. And I think for a lot of these different positive signals, I would be ordering routine blood work as well, CBC, comprehensive metabolic panel. Think about an LDH for, in terms of, cell death and turnover. That could be an interesting marker to follow. I think some of the more challenging cancers could be cancers of the lymph system or in the blood. That might require a full body CT and think about a PET scan too. So those kind of stand out where you have to do because there's not a unique anatomic site, it's the entire body. I would do a broad workup looking at lymphadenopathy, and then again, blood work would be very important for those patients as well, obviously. One question that comes up very frequently is, gosh, what do you do if you have a negative test, if the cancer signal is not detected? Well, when do you repeat that MCED? Should you repeat that MCED? And we don't really know right now the best screening interval. Screening intervals are always tricky because if you screen more frequently, you're probably going to detect more cancers, but is that worth it in terms of cost overall or the risk of false positive results? So that could be challenging. I think for patients at very elevated risk of cancer because they have a very strong family history, they have a known genetic syndrome, cancer screening with MCEDs might be more than once a a year. But for patients with a very, they're over 50, but they have almost no cancer risk factors, I would very much doubt they would need cancer screening that frequently. I think another good question that comes up is when we think about the workup, going back to the patients who have a cancer signal detected, it's detected, you do the most thorough workup, you even get a specialist involved, and it doesn't seem like there's any cancer that's detected. Well, what's the next step there? Actually, the next best step would be to repeat the Gallery test. So they would and actually, it's the nice thing is that's covered. There is if you do that workup, they will run another test to confirm that first test, and I believe that is free. So our take-home points today is we have to become familiar with how MCEDs work in terms of their mechanism, but also in terms of the practical aspects of getting the test ordered, interpreting the results correctly, and then taking action on those results, particularly when there is a cancer signal detected, so that we can initiate the right kind of workup to diagnose cancer as soon as possible with the least amount of stress and worry for patients. I want to thank you for joining me today, and thank you for joining me on this entire Monday Morning Joe MCED series. It was a real pleasure to be with you, and hopefully you found the series helpful. Please remember that clinicians, nurses, and pharmacists can also visit exchangecme.com for free access to CME in a variety of different therapeutic areas, and that includes other Monday Morning Joe series. And we will look forward to seeing you there. Be well, everybody.